to, sorry, how the RAC is going to progress and what the expectations are. A Rules Advisory Committee, or RAC, is essentially just an opportunity to share your insights and your experiences about how the rules are written and how they'll be implemented. So this is really an engagement opportunity where we can ask questions, we can talk back and forth. It's a little bit different from public hearing, where that is essentially just gathering testimony on feedback from individuals. So for our group norms tonight, the things we want to focus on are bringing an equity-driven perspective and approach. We're centered on children, families, and early learning professionals. We want to stay curious and welcome other points of view. Seek first to understand and then seek to be understood. We please ask you to remain present as much as possible. I understand that that life happens, so just please stay present as much as possible. Be impeccable and respectful with your words. Be aware of the power and privilege that occurs within this group. And also, I do apologize that we started a little bit late, but I promise you we will hold this meeting to the 7 o'clock end time, just to respect your time that you've provided us this evening. So going into the changes that we've got, essentially we have 6 different rules that we're making adjustments to in this RAC session. The first one is regarding changes to how a child care need is established when we're talking about a child who's engaged in distance learning. So this is a school-age child who's participating in distance learning. These next rules that are outlined here, this is really just language clarification. So when we moved our program over from Oregon Department of Human Services to Department of Early Learning and Care, we essentially had to pull all of our rule language out of integrated rules with other programs. So our rules were mixed together with SNAP rules and the Domestic Violence Assistance Program and cash assistance rules. And we had to pull those all over into a new rule set. With that, there's some language cleanup that needs to happen. And so you'll see some of that tonight. And then also an exciting change is that starting March 1st, we'll have income limit increases for the ERDC program. So both the initial income limit as well as the exit limit, and then the copay tiers are based on federal poverty limits. And these update once a year. And so we're doing this in alignment with other self-sufficiency programs. So like I said, SNAP and TANF, they're also making these changes effective March 1st for the income limit. So diving into the specific rules. So the first one we want to talk about is essentially the one regarding distance learning. So the history on this rule is that it was an expansion that was put in place during the pandemic, when all of all of our kids were sent home, and the child care providers in Oregon were all of a sudden faced with having children who were in mass participating in distance learning. So we had a separate rule that was for COVID-related policy changes. And in that rule, it said that we could cover the time when a child's engaged in distance learning if there was a COVID-related concern. And so around the beginning of the school year, we would send out clarification to child care providers. And we tried for August. I think one year we also sent out clarification in January, just about when we could cover distance learning. When the rule set moved over to Department of Early Learning and Care, the COVID rule was essentially ended. It was repealed. And when that happened, we actually lost some of the language that talked about the distance learning needing to be occurring because of COVID-related concerns. So when we realized that, we went to add the language back in, but it made more sense to broaden it to specifically call out medical-related concerns. And with this is essentially if a family is experiencing something either with a medically fragile child, medically fragile household member or relative, and it's to the point where they don't want their child participating in school learning because of that, then that would allow the child care to be covered. I think also in our conversations, we've talked about broadening this language as well to cover mental health concerns for a child. And you should all have the RAC packets that have the exact rule language. So I want to open this up for discussion or questions.
Yeah, and there is a comment in the chat from Annalise. The union had
Oh,
requested to
okay.
meet. We have concerns around the language itself. That's not sufficiently clear. We also have concerns about what may be rule language. How does a family and a provider approve this? Who is responsible for overpayment should be included in the law, and the responsibility for establishing the medical, what that looks like. Jen, I'll let you speak a little bit to the questions, but I would say that I know that Allison Delory has been working, trying to get something scheduled with the union to talk about the rule language in itself. And Jen, I'll turn it back to you.
Yes, and we definitely want to hear those concerns. The intent here is really to allow the flexibility to be able to cover children who are participating in distance learning. Um, Honestly, when it comes to things where parents feel that they need childcare for their child, we would really be looking at the parent's assessment of, you know, can the child participate in, or sorry, is there need to have the child participate in distance learning because of these like medical concerns or mental health concerns for the child. Um, that we really leave it up to the parent to make that decision. One of the things we felt we couldn't do in this rule is we couldn't ask for medical documentation. So in other things like with the special needs rate, we do require medical documentation in some instances. Um, but because this could be medical concerns for a household member that's not on the employment related daycare case, or a relative that maybe doesn't even live in the home, we can't be accepting medical documentation for people who are outside of that employment related daycare group, the family group or the case. So that was a piece where we felt like we couldn't ask for that sort of documentation. And yes, medical related concern is very broad.
I think where the union was concerned is because if a child is too medically fragile or someone in the home is too medically fragile for the child to attend school, how is that different than being in a childcare program where they're exposed
Right.
to just as many germs? And then the other thing is that it was made very clear to childcare providers in the letter that we aren't supposed to help the child with anything aside from getting on the computer and maybe navigating to where they need to go. But as most of us learned working through COVID, that's not the case when a child is hybrid learning or distance learning. You end up spending copious amounts of time sitting with the child, either keeping them focused, helping them navigate, all those various things. So with the current rule language the way it is, it kind of contradicts what childcare providers actually end up having to do when a child is in their program distance learning, as well as it completely negates the medical reason, because in a childcare program there's just as many germs as there are at school, and if not
Yeah.
more, because we're in a home, in a closed setting, closer together, more in each other's bubbles.
Yes, and this is really meant to give families options. It's not meant to tell providers that you must provide this type of care. We would never tell providers that you have to provide childcare for school age kids engaged in distance learning, because I understand that depending on the child, the age, the setup of the distance learning, because during COVID, we saw huge differences from school district to school district as far as how much support there was. And in some of the conversations that we've had with people, it, the parent thought this was an option, but then it turns out the child couldn't get the support they needed to engage in distance learning. And so they had to essentially change. So this is really just meant to give options for people. And in some cases, they may choose family, friend, and neighbor care, where it's someone that is already within their circle of people that they have contact with. They may choose licensed care because even within licensed care, it could be a smaller setting than some of the really large schools where they have all sorts of children sharing spaces. So, like I said, this is really meant for the parents to look at what they feel that their needs are as far as childcare and give them that option if they feel a concern either for their child or for someone that has frequent contact with that child.
I'm assuming that Annalise still has kids. That's why she's muted and using the chat.
No, I'm using the chat, so there's a
okay.
record of what I am sharing with the state, and so that we can use this if we need to injunct the passage of the law.
Yeah, I think the reason for the meeting that Annalise was talking about was because we had some language suggestions around this rule that would make it more clear to childcare providers and for parents of what is allowed to happen in a program.
And I know Allison's been working with you. I don't know how you want to provide. I'd love to see any any feedback you have to offer, because this has been a difficult rule to try and figure out where to draw the line. So like I said, the current rule language, it just says that childcare is allowed during distance learning, period, and there are no caveats to that. So this change is really meant to expand what had been in rule previously from just the COVID-related concerns to be able to serve a broader spectrum of families.
Can I jump? I would say maybe adding either, we're seeing a lot of schools trying to work with children with behavioral, and maybe sometimes the full school day is a little too much. And there's families with ERDC that are looking to have some type of, not just medical, but maybe the child isn't ready for a full preschool or kindergarten day, and where if they could have approved care, they're still distance learning because they're still required to complete their schoolwork. They just are not able to stay in class all day, and they'll ask them to break up, maybe try only 3 days a week, 2 days a week. So within this allow the parent to use it as supplemental, because parents can't work. They can't reach out to the provider, their worker or their employer and say, hey, I'm gonna have to shift to only working 3 days a week because my child can't attend school 2 out of the 5 business days, right? So
Yeah.
with that medical, I know that could potentially, instead of just framing it to medical, I don't know, yeah, just throwing it out there.
Yeah, well, we have received some additional feedback earlier regarding medical or mental health concerns. So when there are mental health concerns for the child, it could be a child's having anxiety issues, bullying, all sorts of different things that could potentially happen at school. And so that was some feedback that we had received earlier regarding this rule, and it does make sense because medical concerns, though it is a very broad term, it could be viewed as missing that population, where it may not be an actual, medically documented concern, but it could be mental health issues that are happening.
Jen, also just a comment in the chat is from Annalise, the problem is that ODHS is setting up families and more importantly, providers for overpayments. Again, this is Annalise's comment. The rule is arbitrary and capricious. Options for parents spells trouble with overpayments. It creates loopholes for exploitation of the system that is more likely to come back on the provider instead of the parents. Putting a target on the provider's backs and encouraging expansion beyond the intent. We know that providers are already paying back overpayments for this. We know that ODHS is already enforcing. This is likely to be a huge problematic and encourages abuse on both sides. And I was just wondering if you could speak a little bit about how the school age reports and running for overpayments and monitoring would be interacting with this rule change, Jen.
Yes, so the school age report, that is a current report that that we receive in our system. It essentially shows school age children who are receiving full-time care. Um, this report is reviewed, but it's only reviewed during certain months. So I believe it's reviewed, oh goodness, I want to say I think it's September, October. I'm not sure about September, but I believe it's September, October, January, February, April, and May. So any months where there are large school closures, we just don't review at all. But essentially what that looks like is there's a review, there's contact that's made to the childcare provider just to see if the care was actually being provided. One of the most common things that we see in the school age report is a provider billing for full-time hours for a school age child, even though the child is participating in, they're actually going to public school. They're not at the site. The provider is billing because that's what was authorized on the billing form, so they just billed the full-time hours. So that's the most common overpayment I think we've seen. I don't recall seeing any overpayments this last, or at least not in the last school year, due to a child participating in distance learning. I think the vast majority of them, and not all of them, are reviewed. It's just a portion of the cases that come through on that report are reviewed. But I believe the overpayments were all centered around care that wasn't actually being provided.
And then I think that there's another comment in the chat just really concerning about how the state then monitors and looks at what the medical reasons are for families for their care authorizations. And I was wondering, Jen, if you could just speak a little bit to what happens when a family makes this request for medical concerns or mental health concerns on behalf of a child for these care authorizations.
Well, typically they don't make the request to ODHS because how childcare is approved is it's just approved for the full for everyone in the family, whether they're school age or not. I do recognize that we've got a greater need for the family to have more information about what they're allowed to use childcare for and at what times. So we are working on a parent guide for which we had a parent guide years ago, but we felt like it was a little bit too cumbersome. I want to say it was like 60 something pages long, and it was just too much for families to actually find useful. So we've been working on a more condensed version of the parent guide with some more evergreen information in it. And I can definitely follow up to make sure that we've got information about school age children and essentially when childcare assistance is allowed to be used for school age children. Because I think there are a lot of questions, not just about this, but for families about, if a child, I think like you said, if they go home sick for the day, or they may not be sick, there may have been something else that happened at school and they go home. And then for the distance learning, it's definitely something that would need to be addressed there as well.
Thanks, Jen. And Annalise, I see your comment in the chat around specific providers and overpayments. I think it would be helpful for us to schedule that meeting and work with Al, with the union in particular, if you have instances that you wanted to bring up and talk those through in relation to this rule change.
Yeah, I just don't see any point in passing this language because I think it won't, it has no teeth. It carries, I mean, it's meaningless at this point. And if the feds are allowing it, I mean, if the state can pay for it, then I don't see passing this language as being meaningful at all.
And so I know that Chris had shared some information earlier about how the federal requirements do require us to have some sort of limitation or regulations involved for covering school-age children during school hours. So this is essentially bringing back the language that we had, because we did have, like I said previously, the language said COVID-related concerns, and that was all all it was in the previous rule that was repealed. So this is an attempt to reinstate that, but if we put COVID-related concerns, then it wouldn't help anything at all.
Right, but
So yeah.
so my point is, if the feds now allow a family to have their child homeschooled, and CCDF pays for it, or if the feds allow, a family to do distance learning and have their child in care during the school day when they could otherwise be in school, which I don't remember that being repealed by the feds, but okay. Then what's the point even of having this language? Just have in there that at parents' discretion, then the rule could be at parents' discretion, a child may attend daycare when they do have an opportunity to be in school. I mean, right? If that's what the feds say, then why not pass this? Because here's the thing, all a parent literally has to say is, for this to be invoked, according to this rule, and what we've said here tonight is, I'm choosing to have my child in care during the school day, and I'm not sending my child to school because of medical reasons. And then that's it, right?
We
I
hear your
think this is
concern.
hard because sometimes parents aren't electing for their child not to attend in person. Sometimes that may be imposed either by a occupational therapist, whoever they may be. We don't necessarily know the situation, but there are many times I myself have seen where a child doesn't have the opportunity to be in class, and it might not be for a medical, like they said, it could be a behavioral, it could be emotional distress, there could be a numerous, and then it's hard to say we need a diagnosis, especially because I serve a rural area where it can take years for a family to officially receive a diagnosis because of the lack of resources that is available on the South Coast, and families are having to drive into Portland and ask for rides. So we're gonna I see as requesting diagnosis as adding barriers, unnecessary barriers, maybe calling out, like, if it's a need, it's a need, whether it's medically or at the discretion of, education team or whatever team it may be, that the child has to attend virtually or, yeah.
Yeah, I totally agree with that, Vanessa. I mean, if a child has behavioral problems, that fits under, I mean, if it's anything that could be diagnosed, that's a medical reason. And if we're going to create a rule that says it's at the parent's discretion, then there's no point in creating the rule or the law at all. You don't need a rule, you don't need the law, because the parent has the discretion. And if they say it's a behavioral thing, that could be a medical reason. If it's anxiety, if it's mental health, that's definitely a medical reason. So I don't see the rationale of passing a rule unless you just say, parents at their discretion may use ERDC while their child is engaged in distance learning or homeschooling situation while the parent works.
Well, I believe this is an amendment, not a new rule. The rule is already in place, but it calls out specifically to COVID. So they're just amending to remove the COVID because of right now.
And Annalise, what I want to to say the federal CFRs didn't change. The CCDF guidance was more flexible during COVID that allowed for distance learning and childcare billing for medical reasons. They're not repealing that. This guidance allows for billing for homeschool for medical reasons and for mental health reasons. We are not opening it up, as you are stating, to any homeschooling situation. This is only for medical concerns or mental health concerns specific to the child. So it's it was just a little over broadening it because it's the guidance changed on the federal level, opening up when there's medical concerns and homeschooling. It's not to
Right.
for any
No, I
person
totally understand.
homeschooling.
I
But
totally understand. And
yeah.
I'm not saying it opens it up to everyone. What I'm saying is if it's parent discretion, it really kind of is opening it up. Because if you don't actually need anything, then what this rule says is if the parent says so, then it shall be. I'm not saying that what you think the rule says is what the rule actually says. And correct me if I'm wrong, but the COVID stuff was repealed with the last
Right.
ERDC change. We are adding this back in. So this language does not currently exist in the current rule, right?
The current rule just flat out allows distance learning, which is out of compliance with the federal regulation.
Right,
So
right.
it was the COVID specific piece that was living in that COVID rule that got repealed. So it's currently out of compliance, and we're moving these in to put them back in compliance. I will say that we do have there would be some administrative issues with trying to say that a parent has to somehow get a school-age child authorized for this, because the way the system currently works, it authorizes all children on the case for whatever the maximum hours are. And there's really no control system to stop a school-age child from being connected to a provider with full-time hours. So there's no way to regulate it within the system. So even if we had parents say, I'm going to get my child authorized for childcare during distance learning, we would have no mechanism within the current systems to even track that. So it is something that would have to be based on the parent's discretion. Like I said, we don't want to ask for medical documentation, especially when we're looking at, we don't want the grandmother's medical documentation who lives in the home but isn't part of the ERDC group. We don't want documentation for maybe another relative that comes to the household often. We can't receive and store that documentation within our system in a current way, because it would have to be attached to the individual. And if they're not on the case, we can't attach that medical documentation to that case. So there are some limitations just within the system where, yes, we are relying on the parent's discretion, and just recognizing that that the parent, their interpretation of what their child needs is what we really want to go based on. And it is also up to provider's discretion if you want to provide this type of care, because I think, Vanessa, as you called out, it's a difficult type of childcare to provide when a child's engaged in distance learning. And also just that combination of not knowing what exactly the child needs within distance learning and what assistance is offered from their school district or the school that they're participating in.
Hey, Jen.
Yeah.
It's Tara. I just wanted to be mindful of our time because we're at 6:37 and we're still on the first rule. So I was wondering if we can just maybe touch base with the union outside of the meeting for the rest of this, just so that we can make sure we get everybody out at 7 and we get to provide the opportunity to look over the other rules.
Yes, and I believe, Annalise, you said you have suggestions for changes to the rule language as we've proposed it. Perfect. Okay. And will you be sending those through to Allison?
Well, without having some more discussion, no, because I have multiple ways to go. So if you want to meet and discuss, fine, we can do that, and then we can provide some language.
Okay.
Or we can simply make public comment and then deal with the after effects through the legal system, whatever you would like to do. However you'd like to handle it, it makes no difference to us. But it would certainly seem prudent for us all to meet and discuss this ahead of time, and not have to do on the back end, because that's just costly for everybody.
Yeah, and I believe Al had looked for some times for us to meet prior to this meeting itself, but we couldn't find any timeframes that worked. So I believe she is still looking for timeframes for us to set up that meeting. Okay. So let's move on to the next rules. And so this is a group of rules that, as I explained in the beginning, well, actually, these are a little bit out of order. So this is the rule regarding the income limit changes. And within that packet, you can see you'll be able to see the new income limit. But essentially, we received new income limits. I want to say it was near the end of January. And so typically we align with other SSP means self-sufficiency programs. So that's the Oregon Department of Human Services. So like I said, that's SNAP, domestic violence, refugee programs, and cash assistance. So all of the programs work to update those at the same time. What this will look like in the system is this is set to have the new higher income limit. So all of the income limits are increasing for the initial income limit and the exit limit, as well as the copay tiers. These will be released into the one system on a bill that's scheduled for February 26th. And there's also going to be a mass update done with that. And I know that's getting into the technical terms, but what the mass update means is if someone, like say for instance, they were reapplying for ERDC because their ERDC was due March 1st, and say their income is over the current income limit, but not over what those new income limits are going to be in March. When they run that mass update, even if that was, processed at the beginning of this February for March 1st, and they were denied because they were over income, that mass update will go in and check for anyone who either received a denial for being over income, but they're actually under the new income limits. And it will also readjust any copays if a family's copay tier changes. With this change in particular, it's always a very tight time crunch. So the federal our federal partners typically don't release the new federal poverty limits until near the end of January. Sometimes it goes into February, depending on the year. We try very hard to get everything in place by March 1st, because any delay to this is really just, it's harming families that could qualify for benefits or qualify for more benefits. So we recognize that the February 26th release is not ideal. Typically we would try to release something that would impact eligibility at least 45 days before the actual change is going to occur, but in this case, it's just a very tight time frame. So some of the things you may hear from families is that if their income was just barely over those income limits, they may now be eligible. Or if their income happened to be really close to one of those copay tiers that we have, we might see someone who qualifies for a lower copay from 1 month to the next. And do we have any questions about
We do. We have a question in here. The last one is, how is the state planning to fund this given the wait list? Annalise, are you talking about the income limit and copay amount changes? If you're speaking to us, you're on mute.
Okay. We can't hear anything being shared.
Yeah,
So-
Jen, I think we're having audio issues because I see Vanessa and Annalise talking, but I can't hear.
We're on the phone together, so that's why you can see us both.
Okay.
Oh, I thought you guys were trying to talk to us. Okay, I was like,
No,
you're muted. Okay. So Jen, did you hear the question that Annalise had Annalise, are you referring to the income limit and the copay amount increases?
Yeah, for real. Yeah.
Yeah, and these are, because these are annual updates that occur every year, they're already planned. So they're part of the plan for the budget. They're being viewed for budget deficit and for wait list. So these aren't they're not surprise increased costs. So yeah, that's I guess that's about all I can say about that. Is we knew this was coming, and this is part of the budget plan for this year, and so I hope that answers the question.
Yeah, I think we're good. I think we can go ahead and move on.
And it looks like um yeah, it looks like there's a more of a comment in the chat. So just want to call out for the exit limit. So historically, our initial income limit is the 200% of the federal poverty limit, so that aligns with the SNAP program. And then our exit limit has been either 250% of the poverty limit or 85% of the state median income, whichever one was higher. And this year, actually, all of the household sizes, so household sizes of 2 up to 8 or more people in a family, landed at the state median income. So our exit limit is actually at 85% of the state median income, which is what our federal partners, what CCDF says has to be our top income bracket, essentially, for CCDF funded childcare. If we wanted to fund anything higher than that, then it has to come out of state general fund and not the federal funding. Okay, so I'm going to move us to the next rule. So this next rule, what we're looking at is that the rule for our eligibility groups. And essentially what we found in here is this one section of the rule. It talks about each individual in the household group who's applying for benefits is an applicant. But in other places in the rule, it pretty clearly defines an applicant as a person who is actually applying for benefits. So that tends to be either a parent or caretaker, or it could be an authorized representative for a parent or a caretaker. So this is a piece and rule that we don't consider a child as being someone who's applying for benefits. It's a parent or caretaker who's applying for them. So this is really just cleaning up the rule language and making it align with the other sections in the rule that already call out the fact that an applicant is the parent, caretaker, or authorized representative who's applying for benefits on their behalf. Make sure I can see the chat just in case there's any comments on this. Don't see anything. So if you think of something later, you can still pop it in the chat, even if we've gone past it. But I'm going to go ahead and move on to the next one for concurrent and duplicate benefits. So essentially what this piece is talking about is when someone can be in on more than one ERDC case. And the section of the rule, it calls out people who are participating in a very specific program. It's OSIP AB, and that's Oregon Supplemental Income Program Aid to the Blind. This piece of rule was actually connected to another self-sufficiency program. So it was not even tied to the ERDC program. So when we were over in that combined rule set with other self-sufficiency programs, this belonged to another program. And somehow it ended up moving over with us. So this is really just rule cleanup and removing this out. We don't anticipate this will have any financial or fiscal impacts on anyone or change anyone's eligibility. So I will move on to the next one. this is a piece regarding decision notices and when they need to be sent. The piece in the rule that we found is there's some specific guidance about when notices regarding an intentional program violation are sent to parents. However, in the ERDC program, we don't have intentional program violations for parents. It was determined a long time ago that the program is a benefit for children. So reducing a benefit, usually an intentional program violation will cause a reduction in benefit. So reducing a benefit, even if there was an intentional program violation or fraud is another way to say that, that would be harming the child, and that is not how they're supposed to work. They apply to families in other self-sufficiency programs, but they've never applied to families in the ERDC program. So this piece is being removed. We found a section in the rule where it refers to a caregiver, but we refer to a caretaker as being either they could be the parent, but a caretaker is also someone who has care and control of the child. We don't use the term caregiver. So this was just a mistyped section or just mislabeled. And then also another change that we're making is currently within rule, in order for someone to withdraw their request for benefits or end their benefits or reduce their benefits, they have to sign a form. So they have to sign an actual 457D is the name of the form. But most of the time when we see parents contacting us to try and end benefits, it tends to be because they've moved. So either moved out of state or moved to a different area. And what this allows is it aligns with some of our other changes that we made to signatures on like requests for benefits. So this would allow someone to actually give us a verbal recorded signature in order to reduce or end benefits. So this is really just looking at telling families that they need to come into an office and sign a form when it's not required for them to apply for the benefits. It just didn't keep up with some of the changes that happened during COVID when we made a lot of those changes. So with all of these changes, we don't anticipate any fiscal impacts. One of the things that we may see with this is like when a family has moved out of state, we just don't end up getting the forms. And so their benefits do end up closing eventually, but they just don't close when they initially wanted them to. But we don't get those requests often. So I'll check the chat to see if we have any comments there. See anything just yet? We're almost done for the night. This is our last rule. I can't say it's the most exciting one either, but this is regarding authorized representatives. And again, there was just terminology that was used in there that I think came over from, it was possibly some of the medical programs. I'm not exactly sure, but there was the term beneficiary that was used within this when, again, the word that's used elsewhere in rule and in our guidance to staff is caretaker. And so we changed beneficiary to caretaker. And like I said, a caretaker, it could be someone who's not related to the child, but it also could encompass the parent of the child as a caretaker. And this shouldn't have any impact. This was just rule language that needed to be corrected. Still nothing in the chat. So then final slide on what we've got to share today is just the timelines and next steps. So we did present this information to the Early Learning Council on January 22nd. Today we have our RAC meeting, and then we'll hold a public hearing on February 10th. So like I said, the public hearing's a little bit different where it's an opportunity for people to testify and to share, not so much the conversation or answering questions like what we have today. And then there's also the public comment period. So this is where if you wanted to submit some written testimony, that goes until February 17th at 5 p.m. is when it closes. And then we'll have one last presentation to the Early Learning Council where they'll actually vote on the rules to determine if they'll pass them or not. And then if they're passed, these rules will go into effect first. So are there any questions on the timelines, or I don't know if you want us to drop maybe links to the public hearing information? We could do that as well in the chat. Okay, I'm not hearing anyone wanting those links. I don't know. Kara or Chris, would you be able to drop the links for the information on the public hearing into the chat just in case?
Yeah, Chris is gone, but I can help out with that,
Oh.
Jen.
Oh, Chris is gone. Okay.
We want the link for the public hearing to be able to join it
Yeah, I mean,
in the chat. Okay.
yeah, because I think that section, it has everything. So it's got like the public hearing, it has information about the public comment as well, if I remember what the
Yeah,
what
let me
the
see if I can
website
find
looks
that. Yep, one more.
like. Okay, and I just recognizing that we're coming up on 7 o'clock, and we promised that we would not go over. So I just want to thank you all for your time today.
Yeah, are we dropping stuff in the chat or no? Because there are 6 minutes left and I'm willing to sit here for 6 minutes and wait for that
Oh,
to
sure.
the chat.
Yeah, I'm getting it
Oh,
right
yeah,
now.
yeah.
Yeah, so yeah.
Yeah, I'm not going to end this before we
Okay.
get there.
Okay, it just sounds like we're ending it right now. And I just am like, no, I really want, not that I can't go search for it, but if I can pull it up right now and have it, that would be amazing.
Yeah, and I think that's saved as well. So I'll look for it too. Oh, good. There. Except I had this slideshow that's taking up my screen.
I have a memorandum about it that Chris wrote, but I don't see like a link to, are you gonna go to it right there, Jen?
Yeah, I think it should be
There
in
it is.
there.
Yeah,
Oh, yeah.
Yep.
Okay, so this one should get to all of it, right?
yeah.
I think that's. I should.
Yeah, there's the Zoom links right there. I see what you're doing. It's
Which
just right on the public
then-
webpage. Yeah.
I'll give everyone a chance to grab that, but this should have. I think this is a website that has all of the information on it. Yeah, we've got our public hearing. There's also another public hearing on certified outdoor nature-based programs. If anyone is participating in their RAC or their public hearing or interested in that as well. Okay, got it. So this is a really good website. It has all of the information about past RACs as well as upcoming RACs and current ones that we have going. Basically, any information you want regarding the rules that are happening with DELC programs.
I guess I do have a little bit of a question.
Yeah.
So for the rule change with the decision notices, would that make it so some families are able to get off the wait list faster because then you guys aren't waiting on a signature from somebody that potentially moved out of state?
At this point in time, with the number of families that we have on the program compared to what were budgeted, to have on the program, we would have to see a really significant drop in caseload to be able to start pulling families from the wait list. Unfortunately, just with a lot of the expansions that we received through, some bills that came through the legislature, we didn't receive funding to go along with those expansions, and so I wish I knew exactly what our how many families we could support is. I could share just in case you guys are interested. Our data, which has some really interesting stuff, but our data dashboard has information about the caseload, and not only the total caseload, but also the caseload of families that are connected to providers. So we have about 12,000 families that are connected to providers with payments going out. But I believe that the caseload that we're budgeted for in this next biennium, it's not quite as high as that 12,000. I really wish I knew the exact number of what we can support. So the caseload has been decreasing slightly ever since July, but it's like I said, it's just not enough for us to be able to pull any families just yet. And I dropped that link in the chat for the data dashboard if any of you are interested in looking at that. And we're just about at time. So
I don't think it copied the right link for the data dashboard.
Oh, you're right. That's the rulemaking link, isn't it? Sorry, doing that again. Yeah, clever.
Well, Jen's putting that in there. She put the Department of Early Learning and Care rulemaking web link in there for just the web page in general. And I also put the information about the public hearing and the link to the Zoom directly in there, as well as where you can submit public comment. And there's a link for that.
I really don't know what is happening with this. No matter how many times I copy the new link, it keeps trying to only copy the rulemaking link in there. So I'm going to close all of these out and then try to reopen them. Better.
Jen, were you trying to get the ERDC data dashboard link in there?
Yeah. For some
Okay, here.
reason,
Let me
it just
try.
there we go. Okay. Well, I had scrolled down to ERDC specifically. So this link will take you to the top, but you can see data dashboards for ERDC, CCLD, which is the Child Care Licensing Division, as well as information on preschool promise, OPK, and then there's some other information on there as well. But if you just click on, when you go to that link, if you just click on ERDC program, it'll scroll you partway down the page to our program information. That's available in English and Spanish. There's also a county level data where you can click on that and then select the county, and it'll give you a breakdown of the number of enrolled families within the county, how many of those families are connected to providers, how many providers there are, and how many families we have on the wait list. And then this is updated monthly. So I just noticed it is 7:01, so I just want to make sure everyone got a chance to grab links, and then I'll be ending the meeting shortly. So you're welcome to go ahead and head out. But thank you so much for your time tonight. And I hope everyone stays safe and stays warm. And good luck with power outages.
Thank you, everyone.
Okay, and I think we're good to go ahead and hop off. Thank you, guys.
Thanks. Bye.